I'm doing the self-care deficit theory by Dorothea Oram. A little bit about her educational background is that Dorothea received a nursing diploma from Providence High School in 1934, and in 1939 she went and got her bachelor's in nursing from the Catholic University of America. She then went on a couple years later to get her master's in nursing, and after that she started working at Providence Hospital and then went to St. John's Hospital. With all of her work experience and degrees, she became the director of the Providence Hospital School of Nursing in Detroit. She then began teaching biological sciences and nursing. She worked her way up from an assistant professor to the dean of School of Nursing in Michigan, Detroit. Some key points of this theory is that she created this theory to guide nurses in understanding when and how to intervene with patient care. Now, there are three main concepts to this theory. The first being self-care, second being self-care deficit, and three being nursing systems. An easier example for this would be adjusting the level of support based on the patient's progress, kind of like training wheels on a bicycle that are removed. Like once you know that they're ready, then you can give them a little bit more independence. This is just a visual diagram and kind of how each core concept ties in with one another and why they're all equally important to this theory. Some benefits of her theory is that it's adaptable. It can be from post-surgery recovery all the way to chronic disease management. So in any part of healthcare, this theory can be used. It also proves that nursing is necessary when patients cannot perform self-care due to illness or external limitations. This also teaches flexibility in nursing by being able to determine the type and the extent of care in order to create effective care plans for patients. On the other side of that, some limitations that this theory could have is the lack of emotional needs, mostly because this theory focuses on the physical needs of the patient, not so much of like how they're feeling, more of what we see as a nurse. Another limitation that it has is on cultural insensitivity. It does not take into account for cultural differences in perceptions of health, illness, and care. And it's also a limited scope. It's more applicable in adults, less for children or dependent individuals. This theory applies to nursing care of patients. Nurses can empower patients to take an active role in their health management, leading to better health outcomes and increased patient satisfaction. Another one is that the nurse and patient share the responsibility of self-care. And the third one is nurses can assess patients' self-care abilities and identify deficits. My personal view on this is I believe it's a great theory. It allows the nurse to advocate for their patients. It also encourages patient independence. And although it's physical, you can still have an emotional aspect because you have to build trust with your patient. Also with words of like encouragement, and they have to be able to really trust you in order to feel confident within themselves. And then these are just some references that I use. I also listed some on the slides. And the last one is a citation for the diagram that I used.